Before we begin, this video is general health education, not personal medical advice. When you exercise intensely, your muscle fibers sustain micro tears, tiny disruptions that signal your body to repair and strengthen them. This process can take 24 to 72 hours. However, soreness, DOMS, isn't just from tears. It also involves inflammation and fluid buildup. While pain relievers ease discomfort, they don't speed recovery. Hydration, protein, and gentle movement support your body's natural repair, helping you bounce back stronger. When you exercise, your body triggers inflammation, a temporary response that helps repair tiny muscle tears. This short-term inflammation is beneficial, signaling your immune system to heal and strengthen muscles. However, if recovery isn't balanced, it can become chronic, leading to prolonged soreness. Lifestyle choices like hydration, protein, and gentle movement support healthy inflammation without relying on pain relievers, which don't speed up muscle repair and may have long-term effects on healing. MedlinePlus. After exercise, your muscles need fuel to repair and grow. Protein provides amino acids for muscle repair, while carbohydrates replenish glycogen stores, especially after intense workouts. Hydration is crucial. Even mild dehydration can slow recovery by reducing blood flow and nutrient delivery. Timing matters. Consuming protein within 2 hours may support muscle repair. But this isn't a guarantee. Focus on balanced meals with lean proteins, like chicken or beans, and complex carbs, like whole grains, plus plenty of water. Deep sleep isn't just downtime, it's when your body releases growth hormone, a protein that signals muscle repair. During this phase, about 20 to 25% of sleep, damaged fibers rebuild stronger. Skipping it delays recovery, even if you eat well or hydrate. Growth hormone also boosts tissue repair beyond muscles, like skin and bones. But its peak is tied to deep sleep's timing. After exercise, your muscles aren't just tired, they're repairing. While rest is crucial, light movement like walking actually speeds this up. Why? Because gentle activity boosts blood flow to sore muscles, delivering nutrients and flushing out waste faster than sitting still. Studies suggest this can reduce soreness and even improve future performance without overtaxing your body. It's not about pushing hard. It's about staying active enough to support recovery without adding stress. When your muscles ache after a workout, over-the-counter, OTC medicines like NSAIDs, nonsteroidal anti-inflammatory drugs such as ibuprofen or naproxen can help reduce pain and inflammation. These are approved by the FDA for short-term use, but they don't speed up muscle repair. They just ease discomfort. Always follow the label instructions to avoid side effects. Electrolytes, like those in sports drinks, can also support recovery if you've lost fluids through sweat. But they're not a magic fix. Some supplements, like tart cherry juice, have shown promise in small studies for reducing soreness, but more research is needed to confirm their effectiveness. The best approach? Combine OTC aids with proper nutrition, hydration, and rest. Never rely on them alone. Muscle soreness after exercise is normal. It's your body adapting to get stronger. But sharp or lasting pain that doesn't ease with rest could signal an injury. Athletes often push through pain, but research shows this can sometimes lead to long-term problems. For example, chronic injuries from overuse, like those in piano players, may not heal properly if ignored. Always listen to your body. Soreness fades, but real pain needs attention. Let's tackle another myth: no pain, no gain. While mild soreness is normal as your muscles adapt, sharp or lingering pain isn't. Pushing through it can lead to chronic injuries like overuse strains. Soreness fades with rest, but real pain signals something wrong. Always listen to your body and see a doctor if needed. It's not about toughness. It's about staying safe while training effectively. Not everyone recovers at the same speed after exercise. Genetics, age, and fitness level play a big role. For example, some people feel sore longer because their bodies break down muscle fibers differently. Age also matters. Younger muscles recover faster than older ones. If you're just starting out, your body might take more time to adapt compared to someone who's been training for years. These factors don't mean one way is better. They just show that recovery looks different for each person. Stress, pollution, and poor sleep can slow down your body's recovery after exercise. Chronic stress raises cortisol levels, which can break down muscle tissue faster than it repairs. Air pollution may also cause inflammation in your muscles, making soreness last longer. Meanwhile, not getting enough deep sleep when your body releases growth hormone to repair muscles can leave you feeling more tired and sore. These factors don't mean recovery is impossible. They just highlight why consistency in stress management, clean air exposure, and quality sleep can help your body bounce back faster. If your muscle soreness lasts longer than a few days with no improvement, or if you notice persistent swelling, joint pain, or stiffness that doesn't go away, it's time to check in with a healthcare provider. These could be red flags for chronic conditions like tendinitis or stress injuries. Over-the-counter pain relievers, like ibuprofen, can help with short-term discomfort, but they're not a long-term solution. Always follow the label instructions and consult your doctor if symptoms worsen. Your body's recovery is unique, so trust your instincts and get professional advice when needed. To recover faster after exercise, focus on deep sleep when your body releases growth hormone to repair muscles and manage stress, like pollution or lack of clean air exposure, which can delay recovery. If soreness lasts longer than a few days, or includes swelling, joint pain, or stiffness that doesn't improve, check in with a healthcare provider. Over-the-counter pain relievers, like ibuprofen, can help short-term discomfort but aren't a long-term solution. Always follow label instructions and consult your doctor if symptoms worsen. Your recovery is unique, so trust your instincts and seek professional advice when needed. Remember, this is general health education, not personal medical advice. For individual guidance,